it up, pump it up.
It's the day with
This is the day to gain inspiration, to make a positive change in the nation. We're inviting you to partake in conversation, to raise your vibration. It's the day that we will all celebrate all of our peace that make this thing elevate. Watch the negative fade away, cause it's the day with Trae.
Grand Rising, everyone. Welcome to the Day with Trae. I'm your host, Trae Holiday. I have the pleasure of welcoming you to a magnificent Monday here on our show. So grateful that y'all have joined us, but also grateful for my guest who's in the building. We got Rahel Behailu. She is one of the program executives at the YMCA of Greater Seattle, focusing on health equity. And I'm so glad that she's here to shed some light on some of the ways that the Y has really been connecting with communities to bring health disparities to light and solutions for those disparities. So I'm so glad that she's here. Also, this is the top of the show. So I'm always glad you're here joining us, because this is where you get to help us grow just by sharing the show with others who you feel could benefit from our daily dose of dopeness. We always work to give you here on the Day with Trae. And of course, as always, if you can't watch us, you can listen to us, y'all. Anywhere you find your favorite podcast, just search Converge Media Network and the Day with Trae. You'll find us there. Okay, before I get into it with Miss Rahel, I get to share that, every Monday, I'm always reflecting kind of on the weekend. And this past weekend, it was so great to be able to be with my son. Now, let me share a real story with y'all. Okay, this is personal. I try to watch things with my son. He is all about acting. So I love being able to engage in shows that can show him young people acting in a very great way, right? So I have a certain eye for it, of course, growing up in it. And so watching different things with him has been such a pleasure, because we get to break down characterization, how they're utilizing the camera, how a camera angle can help when it comes to, sharing a certain emotion with the audience. And so I get really technical with him. But tell me why. I'm watching something with my son and we're diving in and I'm loving it. And I had to take a call. So I told him, I said, now look, you need to pause it, because the next scene that's about to come up is why I wanted to watch this with you. Now, mind you, me and him are watching for the first time, but I know, because I've been seeing clips of this show, that it's about to come up, this specific scene that I really wanted to get his reaction for. So I'm like, you gotta pause it. I'm gonna go to my room, I'm gonna take the phone call, I'm gonna come back. Tell me why he didn't pause it. Okay, so he didn't pause it, and I come out and I'm like, really? Johnny, you gonna watch without me? He was so enthralled that he did not pause it. So the whole moment that I was waiting for to share with him was gone, y'all. It was gone. Okay, now this is where I got the opportunity to truly respond in peace. It took me a second because I had to remind myself of that, but I'm grateful I was able to show him, even though I was disappointed that I didn't get to watch it with him, I was also excited that he was so enthralled that he wanted to continue watching. And I'll say this, when we pour into the interests of the young people in our lives, again, whether they're your children by birth or chosen or other family members or young folks you're mentoring, at the end of the day, when we are pouring into their interests, it's just a beautiful thing to know that our efforts are helping to seed their interests. It's helping to pour water on that thing, help that thing grow, help them see it in another way, in another light. And I'm just grateful that I get to do that with my son, right? So I'm just sharing that personal story with y'all, because this weekend I got to spend some time with him like that, but that moment was lost for me, but it was also really something that was inspiring for him. So win-win all around. Well, after this short break, coming up, we got Rahel in the building, y'all. We're going to be talking all things health equity from the YMCA of Greater Seattle's perspective. You don't want to miss it. Stay tuned. You're watching The Day with Trae. Now's your chance to join the Days to Come Reading Challenge to ignite the civic imagination needed for racial repair in Washington state. Read, discuss, and take action until Juneteenth to bring Dr. King's vision of a truly just society to life. Visit saarcpnw.org for more information.
This May, Seattle Opera presents the return of Bizet's celebrated classic, Carmen. A mesmerizing story of obsession, dazzling sets, elaborate costumes, and iconic melodies make Carmen irresistible. Don't miss Carmen, May 2nd through 17th at McCaw Hall. Details at seattleopera.org.
Welcome back, y'all, to the Day with Trae. Of course, I'm your host, Trae Holiday. Joining me right now, we got Rahel in the building. Hi.
Hi, thank you for having me.
Yeah, thanks for coming.
So happy to be here.
Yeah.
And talking to you.
It's so funny because we have known each other for years in community, for I don't even know how many years.
For a long time.
And I'm really grateful because you have been tried and true in our community. You have stuck it out with the YMCA. And your passion for health equity has now really transpired into so many different events, bringing solutions to the community. Let's talk a bit about what got you started at the Y and why health equity is so important to you.
I started working for the Y about 14 and a half years ago. When I first started working, I came as a Zumba instructor. And then after probably 4 or 5 years, I started working for the Meredith Matthews YMCA. Originally, my home branch was the University YMCA, but Meredith Matthews, as you know, is located in the Central District and served historically the Black populations years and years ago. And as I start teaching different classes, and also even being there I was there for about 7-8 years, the demography of our membership was changing because when there was more and more gentrification happen, people were moving toward the south. But the challenge is, even though people are being pushed out, they're not going to one place. They are being dispersed. That means that they don't have access to the Y anymore. So in about 2015, I decided to go back to school to do my master's in public health, and I wanted to, for my capstone project, I wanted to figure out why the life expectancy of the Black population is shorter than the rest of the population in King and South King County, where the distance is not 20 to 25 miles. The health inequity and the health disparity. And one of the challenges, people do not have access to health and wellness programs. They don't have, they have the highest proportion of the chronic illnesses, but they don't have access to the program. So my work in health equity actually started during that time. And as part of my capstone project, I start teaching classes outside the Y. And that required me to work with community centers, that required me to connect with healthcare institutions to figure out how we can still take the programs out of the Y, but implement them in community so that we can eliminate financial barriers, transportation barriers, daycare, and also all the programs that we had were not culturally tailored to fit all the population. So in trying to figure out how we can do that is how the inception of health equity work started. Is actually we are the YMCA of Greater Seattle is the leading organization nationally in health equity.
Wow.
Because there isn't a department that exists in nationally, specifically that serves community members in communities, tailored the programs in different languages, recruited community health navigators from the community and trained them so that they can also teach these classes to their own community. And that's the only way that we could address. But over the years, I'm sure you're aware of it, the prevalence of diabetes, hypertension, cancer, when it comes to prostate cancer, colorectal cancer, we have the highest rate, but our mortality rate is also greater than everyone in the United States. So the goal of my work is focused on money should not determine how long you live, and it shouldn't determine whether you get diabetes or hypertension. So working with communities who are invested in communities and providing other services as the why, we have a great platform. So how do we work together to address those inequities so that people could live their life, their best life, and also have access to the programs, whether they can afford to be a YMCA member or not.
Yeah, I think that's one of the things that was really striking to me was these health equity programs are not regulated to only YMCA members. I appreciate you leading the charge on this work here in this region because it is so necessary. Yet it's also one of those things that I think people need to understand it exists in order for the people who really need that access to be there when the opportunities are there, when the events are happening. So I'm grateful that you could come here just so we could try to help share some of the work that you all are doing. Now, when, there was a colorectal cancer event last month, and we were there, me and my son, but also Converge was there. And it was great to see that, it was intergenerational, folks were there learning. There was a lot of educational opportunities around, a lot of information was there in the building. But you all do multiple kinds of events like this. Tell us about some of the other events you all have where you're working with partners to make sure that solutions to health inequities are right there in the space for folks to get access to it immediately.
So a lot of the health and wellness programs I actually facilitate in, I have a couple of classes that I facilitate for seniors at the Ethiopian Community Center on Monday and Tuesday mornings from 11 to 12, but that is open to everyone, not just the Ethiopian population. And also on Tuesday nights in the same place, I teach, dance fitness class for those who are not seniors, but also have, a full-time job. They can come at 6 o'clock. All these programs are free. I teach women-only dance fitness class in the North End on Monday nights and Thursday nights. That is also designed for people, for moms who can, who are welcome to bring their kids also with them. That would eliminate, if they don't have babysitters, but they can exercise together also. And it's tailored to each, demographic population. And also, I started teaching line dance classes on, for example, at Meredith Matthews on Thursday morning. And in collaboration with the city of SeaTac, actually, we just started a line dance class on Friday morning that is open for the community. So even though the classes are offered in the branch, community members can have access it. They don't have to have a YMCA membership. We also have started hypertension management classes in different languages. We have partnered with other immigrant communities who has helped us to translate the curriculum in different languages. And these are opportunities that we do have and leverage to make sure that it don't matter what your socioeconomic status is. It doesn't matter whether you live by the Y or not. We are trying our best to reach where you are, and also the programs are tailored to make sure that they're culturally and linguistically appropriate. But besides that, the health fair that you have attended is in collaboration with Fred Hutch. I also work with University of Washington, Seattle Children's Center, when it comes to cancer disparities. One of the issue with cancer is the project that I have been working on is to improve diversity in clinical trial, because a lot of cancer over the years, medication have advanced and have improved, and many patients, when they're diagnosed, they have access to be part of, to participate in clinical trials, except, the Black and brown populations, because one, nobody takes the time to talk to them. Second, it's really hard to navigate the healthcare system. Is not designed for us to do so. So our place is like, how could we work with this big institution so that our people, when they're diagnosed with cancer, get the same opportunity to be part of this life-saving treatment, and might be. And also, after they are done with the treatment, cancer changes everything. My daughter is a cancer survivor. I understand personally what it takes and how much it takes out of the entire family. We want to make sure that those families have the right support, whether it's financial, whether it's housing, whether for the survivor themselves, how are we supporting them to get back on their feet? So our collaboration with the big institutions are how could we be a liaison between communities and the institution to make sure that a patient can navigate the system in a way that is more to create more accessibility is the point. Because like I said, navigating the healthcare system is not created to be easy on, even for me. I'm originally from Ethiopia. I've lived here for 40 years and I speak English and I've been educated here. But even for me, navigating the healthcare system, dealing with doctors who don't necessarily understand culture, some medical providers, have their own biases. Navigating that is what actually is making me work more and advocate more for people who might not have the opportunity to voice their concern. But like I said, the Y has, we have the biggest platform to be that middle person, to make sure that, our mission is every person is entitled to live their healthiest life. And it's not about just attending health and wellness program. It's how do we provide screening opportunities for all of them? So the health fair that we organized, that you have been able to attend a couple of them, I think you came to one we did at the Rainier Center last year. And those opportunities are opportunities for our communities to come in and get their A1C check, their blood pressure check. We have their blood glucose. So we bring all the providers to make sure that people can access that free of charge, and then they can, it's a beginning of starting to take where do we go from there. But in our climate now, where Medicaid and Medicare and is so it's everybody is being challenged, then we're going to make sure that at least we are that institution to provide health access, and then the resource navigation piece of it.
But it's also too, to your point, the Y is a trusted source for a lot of community members, and that is necessary too, because oftentimes the providers of, solutions don't always look like the community that they're looking to serve. And so I think it serves those major institutions a great deal to partner with the Y as well, because they know that the Y has access to community members, has a way of being able to share that these opportunities exist and that the programs are there. But like you said, it's not just about like a health equity fair. It's like, no, come here, get your levels checked. If you have a high level, if there's something that's dangerous, we can connect you directly with the actual provider, which I think this kind of wraparound service essentially is so necessary right now, especially when we think about how there are so many barriers to access. How can we break those down? So I love that the Y is thinking of that. I love that you're in the perfect role to be doing that, from your passion as a Zumba instructor to now. Rahel, it's so great to see, you being such an integral force, at the Y to help guide the understanding of where the Y can be productive and really supportive of communities' needs. And so I appreciate that. Now, as you all may have other things coming up, I want to make sure that I give you time and space to let folks know, are there upcoming events that we should be aware of? Are there certain days? You gave some great days of your classes. Are there other ways that folks can get connected to these health systems that they need?
Yes. So everyone is invited, or we're open. The new program that we have on Friday morning at 10:30 to 11:30, we have a line dancing class for seniors, or it's open to anybody at the Matt Griffin YMCA. We also are launching a hypertension management program. This is an evidence-based program that the YMCA has had for a long, long time. This is the first time we're offering it for community members at Matt Griffin YMCA in Amharic, and we're going to be working on registering people for also in English. On one of the biggest event that we have is on April 18. We have the Healthy Kids Day. So it's a day for children to come in. We have games. We have different things and resources. It's for the entire family. All of our branches do have them. So from Kent all the way to Bothell, everybody is welcome to come in. And also, if you would like more information, if you go on YMCA of Greater Seattle website, you can have all the you can see all the programs that we do have. A lot of times people don't know that we have other programs besides swim and gym. We have our Social Impact Center provides programs for youth, from mental health counseling to housing to job training. So all these informations are on our website, and people are more than happy. You can stop by at one of our branches at the membership desk and ask for information, and we're more than happy to connect you and support you. Our goal is that everyone is, welcome in our spaces, and we're going to do our best to make sure that your health and your social needs are addressed.
Wow. Rahel, thank you so much for joining me today, for sharing all this great information, and for all the work you're doing for our communities. If you have more updates, just feel free to come on back.
I will. And thank you for having me. This is a great opportunity, and thank you for making sure that to take care of our communities. And it requires all of us to come together, and I'm very honored to be here, and thank you so much.
Absolutely. Wow, y'all. See, now that's how you start the week off. I'll wrap it all up right after this break. Stay tuned. You're watching The Day with Trae.
This May, Seattle Opera presents the return of Bizet's celebrated classic, Carmen. A mesmerizing story of obsession, dazzling sets, elaborate costumes, and iconic melodies make Carmen irresistible. Don't miss Carmen, May 2nd through 17th at McCaw Hall. Details at seattleopera.org.
Welcome back, y'all, to the Day with Trae. Of course, I'm your host, Trae Holiday. I want to give a big shout out to Rahel Behailu for joining us today. Of course, sharing exactly what we need to hear when it comes to how we get access to the care that we need in our communities. When we talk about health disparities, there are so many that we can't cover all of them in one episode, but clearly the YMCA of Greater Seattle is doing their part. So if you found some of this information useful, if you're looking to find more resources, get that access you need, make sure you go to their website, y'all, and be there on April 18th for the Kids Health Day. We want to make sure that our kids are healthy and that these health issues become natural conversation in our families, right? We no longer need to hold on to the information and then just see generation after generation dealing with the same health issues. Let's make these conversations normalized in our families, in our communities. And if you're like, I don't know where to start at the YMCA, y'all. Thanks so much for watching. I'll be back with you later in the week. And until then, at 11 a.m., y'all, peace. Converge Media produces culturally relevant content for Black and urban audiences. Our coverage is raw, transparent, and objective, praised by community leaders, government officials, and residents. Support Converge Media today via Venmo, Cash App, or PayPal at Converge Media.